Hi everyone, my name is Leah Crown. I'm the Director of Health and Human Services for the City of Meriden. It is time for our weekly social media question and answer video based off of your questions regarding COVID-19. So thank you all for your questions. As you are aware, COVID-19 continues to be a rapidly changing situation, and the answers to your questions this week are based on the Center for Disease Control and Prevention guidelines, the governor's executive orders, and general disease knowledge as of Tuesday, June 2nd, 2020. So our first question is, what precautions should I take if a contractor comes to my home? So if you have a contractor coming to your home to do some work and they are going to be working inside of your home, we recommend that you and the contractor maintain a social distance of each other of at least 6 feet. Both the homeowner and the contractor should wear a face covering. If weather allows, open windows to increase air circulation, and clean and disinfect touch surfaces such as door handles and light switches. If the contractor is working outside, please maintain a distance of at least 6 feet and wear a face covering if you need to interact to talk about your home project. Number 2, now that nursing home staff are being tested, will this be done once or will it be something ongoing? So this was discussed yesterday on the governor's press conference. So the governor announced during this press conference that nursing home staff, residential community staff, and assisted living services agency staff will be tested on a weekly basis, phased in over the month of June. This is enforced in Executive Order number 7UU issued on June 1st. Staff include, but is not limited to, administrators, medical staff, employees, per diem staff, contractors with a regular presence at the facility, private duty patient or resident contracted individuals, dietary, laundry, and housekeeping, as well as volunteers. Number 3, this is actually 2 questions. Question number 3. How many people are currently hospitalized with COVID at Midstate? And when I called Midstate yesterday, they reported that the number was 12, but wanted me to emphasize that this is a very fluid number. The second part of this question is, should everyone be getting tested or just those with symptoms? So yesterday I had an extensive phone call with the State Department of Public Health regarding their testing strategy. The state did develop a phased testing plan with progressively increased and widespread testing. So right now we're in phase 1, and phase 2 is also included in this time frame, which is June through August. The focus populations for testing are people with symptoms and no symptoms who are in a nursing home and assisted living facilities. This includes staff and the residents. Corrections facility staff, Department of Correction inmates, members of high-risk communities, healthcare workers, and first responders. Phase 3, which is September 1st and onward, adds faculty, staff, and students of state universities and schools. Number 4, if you are retired and do not have COVID symptoms, should I wait until the antibody testing is widely offered, or is that not worth taking? Is there a benefit of either test for seniors? So if you do not currently have COVID symptoms and have not had exposure to someone with lab-confirmed COVID-19 test, there is no need at the present to be tested. Continue to self-monitor your health, social distance, wear your face covering when out in public, wash your hands often, and clean and disinfect frequently touched surfaces often. Antibody testing can play an important role in understanding the virus's epidemiology in the general population and identify groups at higher risk of infection. But at this time, unless your doctor orders you one, there is no general recommendation for people to take an antibody test. Until scientists get more data on whether antibodies protect against reinfection of the virus, everyone should continue to take steps to protect themselves and others, including those that I just mentioned. Number 5, how will recent riots impact COVID numbers? Do you anticipate a spike? So first, I would like to extend sincere condolences to those who knew and loved Mr. George Floyd. Whenever there is a large gathering and social distancing is not being followed or participants are not wearing face coverings, there is a potential for a future rise in positive COVID-19 cases. One of the questions asked during our contact tracing process is if someone attended a large event. We will be watching numbers closely over the next couple of weeks. If you plan to participate in one of the peaceful protests and marches scheduled this weekend in Meriden, we ask from the health department that you please wear your face covering and try to social distance as much as possible. We understand that it may be difficult due to the size of crowds. And as hard as it may be, please avoid handshakes or hugs. Please stay home if you are not feeling well or if you are under self-isolation or self-quarantine due to a COVID-19 diagnosis or exposure. Number 6, if youth sport leagues are set to start June 20th, why can't adult leagues start as well? So youth sports are tentatively scheduled to start as part of Connecticut's Phase 2 reopening plan. We are still awaiting guidance from the State Department of Public Health on how the sports teams can safely return to play. As of today, there has been no word from the governor's office regarding the adult sports leagues restarting. If we receive any guidance about adult sports leagues and when the youth sport league guidance comes out, we will post it on the city website, and we will be asking our Parks and Rec department to send that out to all of the sports leagues in Meriden. We will also post information on our social media. So those were all of the questions that we received this week. I did receive one regarding airborne transmission of pathogens, and I responded to that individual on social media with a link to the CDC website because it was very lengthy and it is not my personal area of expertise, so I wanted to make sure that that individual got their information. As always, if you have any additional questions in between our video segments, please reach out to the health department. We can be reached at 203-630-4226. Thank you, everyone, and be safe.